Hi there, my name's Heather. I'm an RN at Healing Hands. I'm the Director of Education. And at Healing Hands, whenever we hire a new nurse, therapist, chaplain, social worker, we do not just look at the individual with their title, we dig in deep. We orient everybody, has an individualized training plan, and for nurses example, we usually train them for 6 to 8 weeks, depending on, they are assigned a preceptor, maybe 1 or 2 during that training time, just because it's always nice to get a different exposure. There's always a different way of going about things, and we pride ourselves on doing things the right way. We will have that nurse, typically will go with our wound care certified nurse so that they can get that individualized training for wound care. We have our new nurses go with our hospital at home nurses so that they can get that emergent assessment needs and what we do to treat those patients right then and there in the home setting. We also, our RNs will go with a admission nurse for a week so that they can learn how we coordinate care between all of the different disciplines here, what type of therapy the patient may need, whether that be PT, OT, or ST. The resources that patient will need depending on what we walk into and find the patient with their situation at home. So we have our social workers that help with that and our chaplain. It doesn't just stop at learning how to document. We 100% pride ourselves in making sure that the nurses and all the staff have the training that they need to be successful. We have guidance that we give the nurses for patients experiencing exacerbations such as CHF or COPD. We utilize what we call bag tags, which help the nurses know the resources that we have to suggest to the physicians, that reminding of what we can do in the home, such as lab work, IV fluids, medications, so that we're not limited at just sending to the hospital, and knowing what we can do to take care of the patient best at home and keep that continuity of care consistent. We have a wide variety of staff, and I think that that's what makes us so special. We have from ICU nurses to med-surg to women's and children's, and we all come together and we work together, and knowledge is power, and we all share our knowledge. We always and forever will encourage our nurses to excel and get certified in anything that they feel called to be certified in. We have an amazing ostomy certified nurse, our wound care certification, infusion therapy certification. The sky's the limit here, and we always encourage that and love that.